I'm Mr. Rahi. I'm a consultant vascular surgeon and venous surgeon, works in Lancashire Teaching Foundation Hospital in northwest of England. And uh, I am an NHS consultant in full-time job for the last 21 years. And my area of expertise include venous surgery in particular. Endovenous laser ablation is highly effective and very safe varicose vein operation for symptomatic varicose veins. Varicose veins is a very common condition, affect 3 out of 10 people. And this endovenous laser ablation technique is very well established for the last 25 years and has got best results with good durability and very good patient outcome and excellent results. So it causes the vein to collapse without any major surgery, and it is carried out under a local anesthetic technique, but patients who would prefer to have general anesthesia, it can be carried out under general anesthesia as well. It is highly safe and very durable and minimal invasive with best results and excellent patient satisfaction. Endovenous laser ablation is thermal treatment for great or short saphenous vein, which are blue, bulgy veins, which cause symptoms in the form of ache, pain, discomfort, and affect the quality of the life of the patient. So EVLA is the treatment of choice for symptomatic varicose veins, and it dramatically improves the quality of the life of the patient. And this thermal technique is carried out under local anesthesia in the laser theater or laser outpatient walk-in, walk-out setting. And ultrasound is performed and the consultant surgeon passes the catheter into the vein under a local anesthesia. And this procedure does take only 20 to 25 minutes and patient walk home within a couple of hours. EVLA is very well tolerated by almost all patients, and it is relatively pain-free, and there's only minimal discomfort when the local anesthesia is infiltrated, and it is tolerated extremely well in my experience. Certainly, there are a group of patients who would prefer to have general anesthesia and do not prefer local anesthesia. So it can easily be performed based on the patient choice or sometime on the complexity of the type of the veins based on patient and surgeon discussion. But in my experience, 80 to 90% of the patients are extremely happy under local anesthetic technique, and they provide excellent result and good satisfaction. EVLA, or sometimes it's called EVLT, has got no significant side effects whatsoever. There is only minimal discomfort, and sometimes the vein can cause some inflammation, which we call superficial thrombophlebitis, which is not very common, but can happen. but it does settle down in the next few days by the regular use of stocking. So it is relatively completely without any side effects. At the time of the procedure, there would be some discomfort and patient walk home, and most of the patients do not need even paracetamol or simple analgesia, and they can go back to work same day or following day. Yeah, my normal recommendation for the patients is to take it easy for 24 hours, but all patients walk out of the clinic and they do not require any painkillers. Normally, we expect them not to drive on the same day because of the minimal risk of drowsiness, even with the local anesthesia. But after 24 hours, they can safely drive. And because of the stocking for 1 week, we normally recommend to manage with the stocking for a week to provide good long-term result. So in summary, patients can go back to work on the same day or preferably the following day, and there would be some bruising, but that normally does not stop them going back to work. My further recommendation is to avoid sporting activity or hot bath or strenuous exercise for the following 5 to 7 days in order to prevent the opening up of the vein. But normal activity, normal working is absolutely fine. And that is one of the biggest advantage of EVLA. And there is 99% durability and excellent result with EVLA. And patient has got maximum satisfaction with EVLA in my experience.